Typically, refractive and therapeutic approaches will differ in that with refractive surgery, we're dealing with healthy eyes that got good corrected vision, and therapeutic, we're by definition dealing with diseased eyes.
When it comes to a cornea which is irregular or a cornea which is diseased, you face many challenges. You have to burn a lot of tissue either to regularize it, or you do not have enough tissue to correct the therapeutic reason what you're doing it for, or correct the disease what you're treating. You not only have to maintain the minimum corneal thickness, but you also have to give the patient a good quality and quantity of vision what they've come for.
The benefit of the SCHWIND AMARIS platform is that actually we can treat very accurately both therapeutic and refractive treatments with amazing outcomes. But the key benefit is the accuracy and the reliability of the treatments on both the AMARIS and with all the future treatments. The new software and technological improvements that are rapidly advancing are now allowing us to treat eyes that we could only have dreamt of treating previously, but with levels of accuracy that were unheard of even 5 years ago.
The journey with SCHWIND AMARIS has just been one of the most gratifying journey with this ocular wavefront-guided treatments. It not only corrects the refractive error for normal patients like a PRK or LASIK, but it also helps us a lot for keratoconus patients and unhappy patients post-surgery.
So the introduction of channels onto the ATOS has been revolutionary. The customization and the way we can now deliver ring segmentation implantation with the ATOS means it's now far safer, it's more accurate, we can do customized treatments to get much better outcomes for our patients. Centration is of paramount importance when it comes to intrastromal corneal ring segments, because decentration will lead to not only loss of effect, but also potentially to actually making someone's vision worse rather than better. The ATOS really makes it very simple with its centration and with its cyclotorsion control, so as the surgeon delivering the care, you know you can completely rely upon it.
Whenever you have to correct a corneal scar, traditionally everybody would just go ahead and do a PTK, which you just create like a crater and remove it. That induces a lot of unwanted hyperopic shift and removes a lot of tissue. With SCHWIND AMARIS, with the wavefront-guided treatment, because it's correcting the scar, it's doing a wavefront-guided treatment, it's correcting the unwanted aberrations on the cornea as well. Whenever it's a decentered ablation post-refractive surgery, a patient is going to have a very poor quality of vision in terms of glare, halos. So with the wavefront-guided treatment on the SCHWIND AMARIS, they have a very good transition zone where you can have a more liberty of correcting a larger zone, because in a decentered ablation, you need a larger zone to correct the irregularity. You can customize the aberrations. So let's say a patient has an X aberration which is on the higher side, I'm only going to correct that. If patient's Y aberration is normal, I'm not going to touch that. So by helping me customize the aberrations, it is going to help me to save tissue again. So again, the wavefront-guided treatments preserves the tissue, corrects the aberrations, corrects the zone, and maintains the integrity.